All right, we're back for video 4 of the prone positioning and ARDSnet protocol. So for this video, we're going to cover what the ARDSnet protocol looks like, the inclusion criteria, and the initial ventilator setup and what adjustments you can make after setting it up. So the ARDSnet protocol, that picture I posted right there is from one of our textbooks. I'm going to go over some of the things listed on it in a little bit more detail. So the inclusion criteria, all of the inclusion criteria is going to be under the assumption that these symptoms are acute onset, not like they've been dealing with these symptoms for months on end. So the PF ratio needs to be less than 300 because a normal PF ratio is anywhere from 350 to 450, I believe. So if they're under 300, then they're clearly struggling. Then bilateral infiltrates that are consistent with pulmonary edema, because what we know about ARDS is that typically there is quite a bit of fluid buildup, especially in those collapsed alveoli, and that there's no clinical indication of left atrial hypertension. So your event setup for an ARDS patient, it doesn't matter what mode you put them in, whatever works best for them, whatever they're most comfortable on and keeps their numbers where we want them. But you are going to want to calculate their predicted body weight. This is important for their tidal volume settings. You are going to put their settings to where they can achieve the initial tidal volume of 6 milliliters per kilogram of predicted body weight. I saw one thing that said you can start at 8 and titrate down AVs like 1 milliliter per kilogram as they tolerate it, because you do want to keep them around 6 based on the ARDSnet protocol. And then initial respiratory rate should be set to approximate what their baseline minute ventilation was. Whatever they were doing on their own or whatever they were doing before you started making these adjustments, you are going to want to try to match that with their respiratory rate, but you don't want to go above 35. You can also adjust the tidal volume and respiratory rate to achieve a target pH and plateau pressure. The pH target should be 7.3 to 7.45, and the plateau pressure should be under 30 centimeters of water pressure. And then that's the end of this video. So just to summarize, we went over the inclusion criteria for ventilators, ARDS patients, the ARDSnet protocol, and that's going to be all acute onset symptoms. And then we also went over your initial ventilator setup and what adjustments you can make based on what numbers we want to keep it around.